our future, the apple of our eye, the promise of tomorrow, and we believe they deserve better. Changes need to take place.
There aren't too many playgrounds and things for the kids to go out and play, so they're forced to ride the bikes in the streets and on the pavements, and they dash right out into the street.
And no matter how hard they try, parents just can't be two places at once. So from the East Coast to the West Coast, the story is the same.
He always falls. He comes in the house with scrapes and bumps.
But for far too many children, the scrapes, the bumps, the bruises, the unintentional injuries are severe. Children are being hurt in alarming numbers.
Injury kills more kids and young adults than heart disease, than AIDS, than cancer, than liver disease combined.
If you want to focus on getting the biggest bang for your buck, that really would be an injury prevention.
Unintentional injury is the #1 cause of hospitalization and death for young people. But doctors across the country are looking at injuries in a new light. Under the direction of Dr. Barbara Barlow, they are making prevention a priority.
Our programs are based on each site developing a program that fits their own community, that grows from their own community to address their community problems.
By analyzing data to find the problems in communities, building coalitions of people interested in making a difference, communicating the problem to them, developing interventions together, and then evaluating how the interventions work, doctors are putting to use the ABCs of injury prevention developed by Dr. Barbara Barlow.
Injury-free is fantastic in that it's provided us a focus, and then we've been able to look around and find our resources and our strengths and gather more of those in and bring it all together.
If we look at trauma as an injury disease that is an epidemic, the way we approach other epidemics in society is trying to develop a vaccine.
1, 2, 3, whoa!
Doctors of 40 hospitals in 37 cities are joining forces with community leaders to administer the vaccine. They are the Injury-Free Coalition for Kids, and they have hospital-based community-oriented sites from one end of the country to the other, and in all 10 federal trauma regions in between.
When I think of Injury-Free Coalition, yes, I'm thinking about hospital programs all around the country, but I'm also thinking about the smaller CBOs that I work with, the people in government that I work with, the parents and the youth that come to our coalition meetings.
One of the really gratifying aspects of working in Injury-Free is the whole idea of going and finding these organizations, getting them all under one umbrella, getting them all working together so that it's much more efficient use of everybody's time, everybody's money, everybody's effort.
There are cities where people come together to work on pedestrian safety. In San Diego, it meant relaying crosswalks, marking curbs, and adding lights and signs.
This means children can walk back and forth to school with far less danger than they used to.
It's special. It's very special because it's given the people who live here, the community, sort of an empowerment.
In addition to making it safe for kids to walk, San Diego is also among injury-free sites, making it safer for them to ride. Just about all sites work on child passenger safety. Many have certified technicians. In some places, those technicians are medical students.
I've learned about how a day-to-day doctor in an office can make a difference talking to children and families, and how a surgeon can make a difference, and how on every different level people in the community can change how the community views injury prevention.
Many sites are providing training to residents to better prepare doctors of tomorrow and to give today's injury prevention efforts a boost.
All these things benefit the children, and it's a small price to pay to keep a child alive and safe and well.
There are efforts to keep people safe at home. Atlanta is one of several cities that has taken its effort on the road with a mobile house designed specifically for teaching home safety. In other places, people go into homes. From safety at home to safety in the neighborhood, assistance is there. Many sites offer bicycle safety. Little tykes learn the rules of the road in some places. People are advocates for bike lanes in others, and helmets are made available just about everywhere.
And I thank all of y'all for giving it to me. Thank you.
1, 2, 3.
In some cases, sites literally build safe places where young people now play, parents once worked. They actually turned the nuts and bolts, poured the concrete, and worked with coalitions to build playgrounds themselves. And they did so with good reason.
If my child falls and gets hurt, I don't want to have to run to the hospital. I want to be able to know that he fell and he can get up and continue to play.
There are sites that provide small grants to empower communities to address needs as they see fit. In this case, it's a parenting program in Miami.
I could speak on other programs, but I couldn't speak as highly as I could about this one.
Some sites have violence prevention programs where young people learn to shoot with cameras, not guns. Others have gun buyback programs. In fact, one program's weapons has become a work of art in the city of Providence. It is other forms of art that are being canvassed in some cities. Every site has programs that are as different as the community it serves, but they are all geared toward one outcome.
It's about helping children to be in safe places, in supervised activities with adults, doing constructive things, and taking them out of situations in which it's easy for them to get injured.
When it comes to building a case for safety, leaders of the program are highly motivated.
We are here because we believe in this cause and we believe in keeping the kids safe and healthy.
We have hands-on experience, which gives us the motivation and the passion to really go out and prevent the things that we can't so much take care of in the emergency department.
Because they base their work on the proven track record of the Harlem Hospital Injury Prevention Program, sites across the country are looking for results.
Ongoing evaluation of the effectiveness of our interventions helps make sure that what we do is not a waste of time, is not a waste of money, that our interventions are effective.
We can build on each other's strengths. We can learn from their weaknesses, from their successes, from their failures, and not reproduce mistakes, but actually just refine it.
In Harlem, injury rates have fallen 60% during the last 14 years.
The cost of supporting community programs like this one, working together to keep children from getting critically injured in the first place, is relatively inexpensive, and the payback is many, many times over.
I hope every CEO in America becomes part of the Injury Free Coalition. I believe that being part of this collaborative, learning from others, things that aren't published in the literature, but talking with each other, learning from each other, real time, has a certain magic to it.
Dr. Barlow says it is their moral obligation to do so.
The Injury Free Coalition for Kids is a national program of the Robert Wood Johnson Foundation, located at Columbia University Medical Center's Mehlman School of Public Health. To learn more about these and our other injury prevention programs, go to our website at www.injuryfree.org.